So, for those of us who are already taking hormones, we might have already seen some skin changes. But for those of us who are still considering whether or not we want to start, it's really good to have an idea of what to expect, right? So, if you are taking estrogen, you want to know that it will actually thicken your skin. So, that makes your skin stronger. It also will make you produce less oil, which of course can make you have drier skin and reduce breakouts as well. With estrogen, it could actually make your skin more prone to hyperpigmentation. That just means like discoloration of the skin. And you might experience melasma, which is a skin condition that people who give birth or even are on menopause will get kind of like splotchy brown or gray blue spots on their face or body. And as for testosterone, you're gonna get oilier skin that will lead to more clogged pores and breakouts, not just on the face, but on your body as well. And of course, you're gonna get an increase in facial hair and body hair, which will lead to ingrown hairs. Although I did wanna make a note, if you're on estrogen, if you are shaving, if you're waxing, you might still be getting ingrown hairs just because that happens to anybody, regardless of what hormonal shifts you got going on. So I just want to flex my credentials a little bit. Besides the fact that, yes, I am a licensed skin professional and I have been since 2018, I also have the firsthand experience to share with y'all. Like I said, or like my intro said, I started tea while on Plume 3 years ago. So that was back in July 2022. That first picture you see is basically around the time where I first did my tea shot. So that was my skin before I started getting skin changes. Just a few months after that in November, that's when I really started to get more breakouts, redness, irritation. This was probably the most acne that I had personally had in my whole life. Not even in my teenage years did I break out this much. I was experiencing cystic acne for the first time, which is a lot of like deep, painful pimples you can't really pop. And after that, I started to go to my doctor. I went to get a referral to a dermatologist who ended up prescribing me tretinoin. You might have heard of it, but tretinoin is basically vitamin A, aka it's a kind of retinoid. You might have heard of retinol, and that's something you can get over the counter. Tretinoin is something that will deliver those same results that retinol gives you, but it's just a higher dosage and it's gonna give you those changes more quickly. And the third picture, that's about a year after I started kind of getting into my skincare routine for my new skin. And then September started to clear up significantly. And today I did you a favor and I put no makeup on my skin so you can see what my skin looks like nowadays. I want to really point out that, these are just a few pictures, but it is totally fine and normal if your skin changes. Progress is not linear whatsoever. You'll have clear skin for a couple months and then you'll get a breakout that you'll have to deal with for another month or two, and then it calms down and then kind of just keeps happening. Okay, skin is affected by more than just hormones, it's also genetics, of course, external factors. Our skin is the largest organ of our body, so it's going to reflect whatever's happening internally. You might have heard people say like, oh, skin type, blah blah. What does that really mean? Your skin type, think of it as something that you will have for an extended period of time in your life. Your skin type, like in your teens, it might have been different from what it is now. And that is how we determine what kind of products do we go for? What do we need for our skin? With oily skin, I feel like a lot of people think they're oily, but you know you're oily if your skin becomes shiny and oily almost immediately after you wash your face. Some people literally cannot go like a few minutes without their skin producing oil. You will see that your pores are larger, they're more visible, and because you're producing more oil, you get more breakouts. And with oily skin, your skin, of course, will look shiny. The way that I look now is not necessarily considered like shiny oily, but this is more of like a glowy look. Oily skin will be very obviously like all over there, all over the face, very, very shiny. And for some people, it might even look dull. And on the opposite end of the spectrum, when you have dry skin, That means your skin is lacking oil and water. When we have a good balance, that's what constitutes a balanced skin type or normal skin type. But with dry skin, you might notice there's roughness, texture, you might have dead skin flaking off. Your pores are small to basically invisible. Fine lines are very, very visible, and it will look dull from the lack of oil. When you have balanced skin, that's also called normal skin. I kind of don't love the term like normal because that makes it seem like, oh, we should all be like this, but it's not bad or good either way. However, when your skin is balanced, it's able to perform its skin functions more healthily, and it's not going to experience conditions like acne or irritation that will be uncomfortable. If your skin is sensitive, that means you're prone to redness and irritation, maybe burning, even when you're just using really gentle skincare products, even some that are meant for sensitive skin. For some people, they might still get irritation. This will include skin conditions like eczema, psoriasis, or rosacea, which those are skin conditions that are diagnosed. And then lastly, combination skin. I think this is very, very common for a lot of people to have like an oily T zone. Your forehead, your nose, and your chin produce more oil. The pores are bigger there. But then the rest of your face might be more balanced, or maybe even on the opposite side and very, very dry. That's going to look different for different people, but basically, if you have more than one of these skin types happening at the same time, you have combination skin.